Millions of older adults are currently swallowing daily water pills, running to the bathroom to the point of absolute exhaustion, yet their ankles remain completely swollen, tight, and painfully heavy by evening, because modern medicine is desperately trying to drain the wrong biological compartment. The profound frustration of peeling off a pair of socks at the end of the day only to discover a deep, lingering indentation pressed firmly into the skin of the calf, a visible trench that takes minutes to slowly smooth back out, is a daily reality that completely drains the joy from the golden years. When this heavy, uncomfortable swelling is brought up in a standard medical appointment, the immediate, almost robotic response from the medical establishment is to blame the heart, to restrict dietary salt, and to prescribe a harsh chemical diuretic that forcefully strips water from the bloodstream. However, for the vast majority of individuals over the age of 60, who do not possess severe underlying cardiac disease, this generic, heavily prescribed treatment does absolutely nothing to resolve the swollen ankles, because the excess fluid was never actually trapped inside the bloodstream in the first place. The water, often amounting to a full liter of heavy, stagnant fluid, is actually pooled quietly and invisibly inside the loose tissues surrounding the ankle and the calf, and a chemical water pill is biologically incapable of reaching inside those tissues, meaning that the individual is being forced to suffer through the exhausting side effects of a medication that is completely targeting the wrong physiological system. To truly understand why the legs suddenly feel like they have been filled with heavy, wet concrete after simply sitting on the couch for an hour, one must look beyond the heart and discover the second, entirely forgotten river flowing inside the human body, a magnificent, complex drainage network known as the lymphatic system. While almost everyone is highly educated about the circulatory system, understanding that the arteries carry fresh blood out to the body and the veins carry the used blood back, driven by the incredibly powerful, relentless pumping of the heart, the lymphatic network is rarely explained to the public, despite being absolutely critical to human survival. The lymphatic system is a vast, delicate web of microscopic vessels responsible for collecting the clear, pale yellow fluid that constantly leaks out of the blood capillaries, a fluid that bathes the cells, picks up cellular waste, removes dead bacteria, and collects excess water, with the monumental task of returning up to 2 liters of this fluid back up to the chest every single day. The single most critical and deeply vulnerable design flaw of this vital lymphatic network is that it possesses absolutely no central pump whatsoever, containing 0 cardiac muscle to drive the fluid upward against the relentless downward pull of gravity. Instead, this silent river operates exactly like a mechanical conveyor belt, but is entirely dependent on physical movement to function, relying exclusively on the contraction of the calf muscles, the flexing of the ankles, and the physical weight-bearing steps taken throughout the day to physically squeeze the delicate lymph vessels and push the fluid upward, millimeter by millimeter. When an individual sits in a chair for 3 hours, the conveyor belt comes to an absolute grinding halt, and the clear fluid simply begins to pool in the lowest possible point of the body, quietly saturating the tissues of the feet and ankles like water filling a sponge. During the youth of the body, this temporary stagnation is easily overcome, as the lymphatic vessels are highly elastic, and the microscopic one-way valves located inside them are tight and efficient, meaning that a simple, brief walk across a parking lot is more than enough to completely restart the system and clear the accumulated fluid within minutes. However, as the body gracefully crosses the threshold of 60, three distinct, simultaneous biological shifts occur that completely disrupt this delicate balance, as the lymphatic vessels themselves begin to stiffen and lose their youthful elasticity. The tiny internal valves begin to slowly degrade and allow fluid to leak backward, and the surrounding connective tissue of the lower leg gradually loses its firm, tight structure, creating a much larger, looser reservoir for the fluid to hide in. The mathematical equation of fluid balance fundamentally breaks down as the water seeps out of the blood vessels faster than the aging, sluggish lymphatic system can physically pump it away, resulting in ankles that look noticeably thicker by noon and rings that painfully refuse to slide off the fingers by dinner time. The true danger of this lymphatic congestion does not actually occur while standing, but rather the very moment the individual lies down in bed to sleep, because once the powerful force of gravity is finally removed, the massive pool of water trapped in the legs slowly begins to reabsorb back into the central bloodstream, creating a sudden, unexpected flood of fluid that forces the kidneys into a state of absolute overdrive. The kidneys, detecting this massive surge of water in the middle of the night, frantically begin producing urine to protect the heart from volume overload, forcing the exhausted individual to wake up at 2 in the morning and again at 4 in the morning, completely destroying the deep restorative sleep cycles that the brain desperately needs to prevent cognitive decline and cellular aging. This exhausting nocturnal battle is the precise reason why the ankles magically appear thin and normal in the morning, deceiving the individual into believing the problem has vanished, only for the entire frustrating cycle to begin again the moment the feet hit the floor. Before implementing any natural drainage protocols, it is absolutely vital to perform two incredibly simple, highly effective clinical home tests that require less than 30 seconds but provide profound insight into the exact nature of the swelling, starting with the classic clinical assessment known as the pit test. To perform this assessment, one must locate the bony ridge running along the front of the shin, approximately 4 inches above the ankle bone, and firmly press the thumb directly into the tissue against the bone, holding that firm pressure for 15 full seconds before lifting the thumb away and observing the skin. If a visible, distinct crater remains pressed into the skin, an indentation that takes 10 seconds, 30 seconds, or even a full minute to slowly smooth back out, this confirms the presence of pitting edema, an absolute, undeniable physical sign that the tissues are severely saturated with stagnant, unmoving fluid. The second vital assessment is known in the medical field as the Stemmer sign, a remarkably simple test that involves attempting to gently pinch and lift the skin on the top of the foot, specifically the area located right behind the second toe, using just the thumb and forefinger. In a healthy, actively draining lymphatic system, this skin should easily lift and fold between the fingers. But if the skin feels incredibly thick, deeply tethered, and completely impossible to pinch or lift away from the underlying tissue, it strongly indicates that the lymphatic congestion has been present for years, causing the proteins in the stagnant fluid to slowly fibrose and thicken the skin itself. For individuals who experience gradual symmetrical swelling that worsens by the evening, improves by the morning, and leaves a noticeable pit when pressed, without any sudden shortness of breath, chest pain, or dangerous unilateral swelling of only one leg, the solution does not lie in a prescription bottle, but rather in a profound understanding of the hidden daily triggers that silently paralyze the lymphatic system. The very first highly deceptive trigger is the modern consumption of hidden industrial sodium, which has absolutely nothing to do with the salt shaker on the dining table, but everything to do with the massive amounts of chemical sodium hidden inside processed cheeses, heavily preserved deli meats, canned soups, and seemingly healthy restaurant meals. The human body is forced to hold on to approximately 4 entire cups of heavy, stagnant water for every single gram of excess sodium consumed. And because this hidden sodium pulls the water forcefully out of the bloodstream and directly into the peripheral tissues, the delicate lymphatic system becomes completely overwhelmed and unable to clear the toxic, salty flood. The second, incredibly common behavioral trigger is the deeply ingrained habit of prolonged immobility immediately following the largest meal of the day, as the hours between 7 and 10 in the evening, typically spent relaxing in a comfortable recliner watching television, are the absolute worst possible hours for the legs to remain entirely motionless. 3 full hours of seated immobility forces the maximum amount of fluid to pool in the ankles right before the body transitions to a flat, sleeping position, creating the perfect biological storm for nighttime kidney overload and severe sleep disruption. The third, highly counterintuitive trigger that completely paralyzes the lymphatic flow is the well-intentioned but deeply flawed decision to drastically reduce daily water intake out of a fearful belief that drinking more water will somehow create more swelling. In biological reality, the exact opposite is true. When the aging body becomes even mildly dehydrated, the delicate lymphatic fluid instantly thickens, turning from a fast-flowing, clear liquid into a sluggish, viscous syrup that is incredibly difficult for the body to push upward against gravity, meaning that a deeply hydrated body is the absolute prerequisite for thin, healthy ankles. Furthermore, an often completely ignored driver of lower leg swelling in older adults is a silent, creeping deficiency in high-quality dietary protein, specifically a lack of the vital blood protein known as albumin, which acts like a biological sponge that holds water safely inside the blood vessels. When an older adult consumes a diet consisting primarily of simple carbohydrates and highly processed foods, skipping vital queen proteins like fish, eggs, lentils, or quality poultry, the albumin levels slowly drop, causing the water to easily leak out of the weak blood vessels and spill over into the tissues of the leg, completely saturating the lymphatic network. To permanently break this exhausting cycle, to stop the endless midnight trips to the bathroom, and to reclaim legs that feel incredibly light, energized, and visibly thin by the end of the evening, the daily routine must incorporate a magnificent 5-minute biological ritual explicitly designed to manually pump the forgotten river and drain the tissues before gravity forces the fluid into the kidneys. This powerful restorative ritual begins roughly 90 minutes before the intended time of sleep, requiring the individual to lie comfortably on the floor or on the bed and slowly, carefully place both legs straight up against the wall, aiming for a 90-degree angle where the heels are significantly higher than the hips and the hips are resting higher than the heart. By simply adopting this inverted posture for 15 quiet minutes, the relentless daily force of gravity is instantly reversed, transforming from the absolute worst enemy of the lymphatic system into its most powerful, effortless ally, allowing the trapped, stagnant fluid in the feet and calves to finally, smoothly, flow downward toward the center of the body. While holding this incredibly relaxing inverted position, the ritual becomes deeply active with the inclusion of slow, deliberate ankle circles, rotating the feet 10 times in one direction and 10 times in the other, followed by 20 slow, deep ankle flexes, pointing the toes toward the ceiling and then pulling them firmly back toward the face. These gentle, inverted movements act as a manual muscular pump, physically squeezing the deep lymphatic vessels in the calf and forcing the fluid completely out of the lower leg. But the absolute true magic of this nightly ritual occurs with the profound implementation of deep diaphragmatic belly breathing. While the legs are still elevated, the individual must place both hands flat against the lower abdomen and take slow, deep, highly intentional breaths exclusively through the nose, ensuring that the belly significantly rises and expands like a balloon with every single inhale, rather than taking shallow, anxious breaths into the upper chest. This deep, expansive belly breathing is not merely a relaxation technique, it is a profound mechanical intervention that directly activates the thoracic duct, the single largest, most vital lymphatic drainage vessel in the entire human body, which happens to sit directly behind the diaphragm. Every single time the diaphragm expands deeply into the belly, it creates a massive biological vacuum inside the chest, literally sucking the lymphatic fluid out of the legs, through the abdomen, and safely back into the central circulation where it can be properly processed. After exactly 15 minutes of inversion and deep, vacuum-creating breath work, the individual must slowly, carefully roll onto their side, sit up, and perform the final, incredibly effective step of manual lymphatic drainage, using the flat, soft pads of the fingers to gently stroke the skin of the lower leg, starting from the ankle and moving slowly, steadily upward toward the back of the knee. These strokes must be remarkably gentle, applying only enough pressure to slightly stretch the surface of the skin, and they must always, without exception, move upward toward the heart, completely avoiding any downward motion that would simply push the fluid back into the foot. Performing 10 slow, deliberate upward strokes on each leg physically forces the lingering fluid out of the loose connective tissues and directly into the open mouths of the lymphatic capillaries, completely clearing the reservoir that had been quietly building all afternoon. The most immediate, undeniable proof that this ritual is working exactly as designed will occur almost immediately after standing up, as the individual will feel a sudden, strong urge to visit the bathroom, successfully releasing hundreds of milliliters of pale, clear fluid while completely awake and in total control. This is the exact fluid that would have brutally awakened the individual at 3 a.m, ruining their sleep and straining their heart. But instead, it has been safely, efficiently drained on their own terms, allowing the body to finally sink into a deep, uninterrupted, highly restorative sleep cycle. When this magnificent 5-minute ritual is combined with the elimination of hidden processed sodium, the conscious effort to stay deeply hydrated with pure water, and the simple daily habit of performing 30 quick ankle pumps in bed every single morning before the feet even hit the floor to restart the system, the physical transformation over the course of just 3 short weeks is absolutely breathtaking. The deep, lingering sock marks that used to permanently scar the calves completely vanish. The rings slide effortlessly onto the fingers. The heavy, aching sensation in the legs is replaced by a wonderful, youthful lightness, and the exhausting nocturnal trips to the bathroom become a distant, fading memory. The miraculous human body is never truly broken, and the legs are not simply wearing out or betraying the aging system. They are merely a complex, beautiful drainage network that silently stopped receiving the vital, mechanical signals it desperately needed to run efficiently. The profound power to heal the body, to drain the stagnation, and to reclaim absolute, pain-free mobility does not belong to a generic, heavily prescribed chemical water pill, nor does it require accepting the suffering as an inevitable consequence of getting older. It belongs entirely to the quiet, intentional mastery of movement, to the profound understanding of how the body truly works, and to the beautiful, absolute certainty that true health is always waiting to be gently, lovingly restored. If uncovering these deeply hidden, vital biological truths and learning exactly how to naturally, gently, and powerfully heal the body from the inside out brings a wonderful sense of hope, immense relief, and true empowerment to the beautiful journey of aging gracefully, making the firm choice to subscribe to this channel will ensure that these life-saving secrets, honest health conversations, and powerful natural remedies continue to light the way toward a significantly lighter, deeply rested, and far more vibrant life.